because he wanted to come back. He felt like, you know, this is where his family, his roots are, and he knew the need for providers. And so, yeah, and you know, I know of other young people who have done the same thing. So that's really huge to me. I think once that catches some more momentum, it'll be even better, you know.
You know, it's thrilling to hear, Michelle, you know, in the earlier segment, you know, Senator Takamini, he always emphasizes the need for partnering, the need for collaborating. So, you know, to know that you folks are reaching out and working with, you know, the folks from Bay Clinic and others around you, I think that's, you know, just fantastic.
Yeah, and it's so necessary. I mean, we're very small. We're a small agency. As an example, our primary care, we have just one doctor there. So to be able to collaborate with the bigger existing health centers already who have more of the services that are available, whereas in our primary care, we can, because we're smaller, we can take a little bit of extra time to work with that patient to make sure the patient understands. But if it's anything beyond what we can do, then we certainly do referrals like over to the community health centers, as well as we're starting to network with them to see what can we do for them as well as what can they do for us. And one area that we're really approaching is the health navigation field that they mentioned earlier, is being able to assist folks that, you know, it's a little bit scary, I don't know where to go next, I don't know exactly what this means, to make sure that at all of the community health centers, we have a Native Hawaiian health systems representative from Hui Malama Ola na Oiwi who is stationed there to be able to help navigate folks through that system, to maybe calm a little bit of the fear so they're not so reluctant to get that next step in their medical care. Yeah? And then along the same lines, we're working on, actually with our sister agency out on Oahu, working on establishing a program where so often we have folks from the Big Island that, you know, we have no specialty care, we have very limited specialty care. So the next step is fly to Oahu. And once they land on Oahu, they go, well, now what do I do? So we're working with Ola Mamo, who is the Native Hawaiian healthcare system on Oahu, doing like a concierge kind of service where somebody can meet them at the airport, say, Auntie, this is where you need to go, I'll take you over to Queens, and this is what you're going to do when you get there. As soon as you're done, I'll be here to pick you up. But just to lessen some of that fear and some of that stress in addressing it or seeking out additional health care. Along those same lines, we have a program where so often folks are concerned or a little bit scared or a little bit shy to travel on their own. So we have emergency medical assistance where we can literally fund the plane fare for a family member to go, especially with some of our kupuna, to be there with them, to make it so not so scary for them. Yeah? So there's lots of collaborations, and certainly as the community health center, my colleagues there speak about is, you know, we all have to work together. We all have the same mission, which is basically to make sure our communities are healthy regardless of the ethnicity. So we're all focusing on a different area and then trying to come together to make sure the island is taken care of in its whole. Yeah.
You know, clearly health issues don't discriminate. So you know, we're all one big family, and we all need to work together and help each other out. You know, I know that much of what you folks do are anchored in Hawaiian values.
Right.
And I know, you know, at Hui Malama, it's Ke Akua Mana. Folks talk about Lokahi, Ohana, Ho'omau, Po'okela. How does that all work in your daily work?
From the moment we walk in the door, that's really our focus. And actually, our board, from our board chair, our po'o on down, we're very, very aware of protocol. We're very aware of what our mission is and why we're there. And I think that, you know, when our staff actually goes out and is delivering the service, it's every single value comes into play, just in the greeting of Auntie at the door, or greeting of Uncle at the, you know, taking him to get medication. It's always about making sure the family's taken care of, making sure it's a gentle approach, making sure even that individuals recognize their own kuleana in taking care of their health, and really helping to educate folks on, you know, here's how you can talk to a doctor, here's how you can ask the question. Yeah. So I think from, like I said, the minute we walk in the door, that's part of how we deliver services, and I think it's already there in staff. We go through quite a bit to make sure when we hire folks, as an example, that they have the right fit, that it's the right kind of heart and the right reason, that they're coming to us looking for employment and not just there to get a job, but really about, you know, regardless of the pay, as an example, I'm there because it's important and I want to take care of my people.
Can we have a little commercial break now?
Absolutely.
Because I think we need to provide some contact information on
Absolutely.
how people can access your programs.
Yes, thank you.
Yeah,
thank you.
please.
Best way is if you just call our main office, which is in Hilo, and their direct line is 969-9220. And most likely you will speak with Val, who is our receptionist, and she can give you all contact information, location, maybe what entity you'll be talking to. If you call in Ka'u, this is who you'll be speaking with. But best is to call our main line, 969-9220. Yeah.
And you have the outlying offices again in Pahoa?
We have outlying offices in Pahoa, also in Waimea, in Ka'u, in Captain Cook, and where did I forget? And then in Hilo is also our admin office and our Hilo outreach site. Yeah.
Great.
Yeah.
And Ka'u is where? Which town?
In Naalehu.
Naalehu.
Yeah.
Terrific.
Yeah.
Oh, great. And Hardy, you know, I'm fascinated because, you know, I was looking at your Papa's website today, and you folks have the canoe and the 6 paddles.
Oh, we're going to go along. We only got a minute to go, and we're going to talk about that.
Oh, okay.
We'll make it quick. We've tried to integrate in our structure the Hawaiian canoe as our model, and so as you know, there are 6 seats in the traditional canoe, and so we have divided up our organization into 6 departments: education, research, health services, health promotion, disease prevention, traditional healing, data and information. And there are reasons for that. You can't really steer your canoe unless you have the information or knowledge about where you're going. So data and information is our steers. Seat 1 is our education. You only can go as fast, stroker, as education allows you. Research is seat 2. Research calls where you focus on. Seat 2 calls the change, where you put your efforts. Health services in 3 and 4, disease prevention, health promotion are your power seats. That's what's going to get you into better health quickly. And then traditional healing, 5, health's the steersman. That's a reminder that, hey, in times of real necessity, you have to revert back to what makes sense. What were the traditions of your community and your people? So that's our motif.
Terrific.
You know, I know it's times where I just want to say aloha to Sonny Kinney and Jenny out there, because they were really instrumental with Pinky in forming some of these health programs. And I know this is going out to the Big Island. So
well, we thank you both for being here and sharing all this great
thank
information.
you. Thank you.
Really appreciate that. Bobby, I think this is going to go a long way in keeping our community educated.
Thank
Hallelujah.
you.
Thank you, Senator.
Yes, you're welcome.
Thank you,
Aloha. Thank you for joining us today.
Wow, that went fast.